Rajita, go ahead.
Good afternoon, ladies and gentlemen, honorable dignitaries, fellow faculty members, and amicable student delegates. I, Rujita Bagre, Joint Secretary, RESCARE'21, take immense joy to extend you all very warm greetings on the behalf of the entire organizing committee of RESCARE'21, the 14th National Conference of the Indian Association of Respiratory Care. It is my pleasure welcoming you all to the day 2 of the RESCARE'21 conference. Yesterday, we had a very successful free conference workshop wherein we had a live demo sessions on various topics from various diverse locations of our country and abroad. Now it is my great honor to welcome you all to the inaugural ceremony of the RESCARE'21 conference, which has been sponsored by the Briarwent Ventilator Lifeline Brisk Private Limited. We will also be live on our official IRC YouTube channel. We are extremely sorry we do not have our president, Dr. Jerry Paul, so with us right now. Dr. Madhura Gauri Shevde, our Associate Vice President, will take over and address the audience.
Thank you, Rujita. Thank you for the kind introduction. I understand that Dr. Jerry sir was unable to make it currently. However, he sends his apologies as well as best wishes to everyone. Without wasting much time, I think I am one of the youngest in the group here. So it is my honor to invite everybody, to thank everybody who has joined us today. We have grown up, watching and learning from each one of you since day one of our respiratory care or respiratory therapy, life as a student. And we could not have asked for a better platform to have everybody on board and guide us through since day one and in the future also. So I think I will keep it short, and I would just like to thank everybody. We are extremely, extremely grateful for each and every one of you. And we look forward to all of your continued support and blessings. Definitely your pearls of wisdom are something that take us really, really far. So thank you once again. Over to you, Rujita.
Thank you so much, ma'am, for your inspiring warm words and your warm welcome remarks. And thank you also for addressing the audience. So now I would like to call upon our organizing secretary of RESCARE'21, Ms. Kumari Salochana, for the welcome note.
Good afternoon, all the eminent scholars and invited guests. I am elated and pleased to welcome all our keynote speakers, pioneers, stalwarts, committee members, and my fellow artists to the 14th National Conference of IARC 2021. This is the first virtual conference in the history of IARC aligned with social distancing norms due to COVID-19 pandemic. It's my pleasure to announce the theme of RESCARE 2021, which is Respiratory Therapists, Advocates of Patient Safety and Quality Care. This conference is built with the intent of active and interactive learning. So I hope you will enjoy all the sessions, and it's wonderful seeing all you here for the first day of our conference, RESCARE 2021. Once again, thank you all.
Thank you very much, Ms. Salochana, for that welcome address. Success is not the key to happiness. Happiness is the key to success. If you love what you're doing, you will be successful, said Albert Schweitzer. When we look back, we realize that it's our pioneers and stalwarts' efforts and contribution to develop this platform of respiratory therapy that has molded, encouraged, challenged us, and raised us to higher standards. Our pioneers have played a big role in establishing our profession, and it is all because of them that we are here today. With great pride, I take the privilege of saying it loud, and that it's been 25 years of us, the respiratory therapists, have embarked our journey in India. With that, I would like to welcome you all formally to the Silver Jubilee celebrations of IARC. Let us all seize the moment and embrace this journey with a short video. Extremely sorry, we are facing some technical glitch. We will be playing the video shortly.
Ruchita, I think you can get going with the other speakers, and whenever the video is ready, you can play it.
We can play the video once we are ready with it. Meanwhile, I would like to move on. We are blessed and honored to have with us today the visionaries and stalwarts of IARC. Now, I request the technical team to play a short video clip from Professor Vijay Deshpande, Emeritus Professor, Georgia State University, Atlanta, Georgia. He also served as the governor for India for more than 15 long years. He was the constant source of inspiration and a fatherly figure for most of our seniors in the profession, and certainly a grandfather for all of us, the current generation respiratory therapists. Let's listen to his heartwarming words and wishes for us.
Good afternoon. My name is Vijay Deshpande. I am a part of Indian Association for Respiratory Care. I've been involved with respiratory care in India for about, I would say 15, 20 years. But before that, I was in US and was there for a long period of time. And I was a respiratory therapist. 25th anniversary of any organization is a great achievement. This shows perseverance, continual interest by the members, and an aggressive approach to move forward with the technology and other things developing. I'm very happy to say that your current group of members, let's say active members such as Jitin, then Sulochana, then a few others. I'm sorry, I forget names most of the time, but they have done a lot of work lately. Now, you will hear a lot about the professional development in India. And since I stepped in at a little later date, I can enlighten you on where is the profession coming from and how did it happen. It was initiated in Chicago in 60s, 1960s, 70s, 60, 65 or so. And I happened to be there in the early phase of the profession. I started working as a respiratory technician in 1971 at University of Chicago Hospital. Now, some of you would say 1971. Even my dad wasn't born at that time. Now, that's the way it goes. I'm very happy that I live longer, just a little longer. The point is, during that phase, we were going through very rudimentary, basic therapies. The reason the profession slowly developed was the physicians, the doctors, were reluctant in doing mundane things like aerosol therapy, oxygen therapy. Wow. No, they just didn't want to get involved with that. Nurses had lots of other things to do, so they were also very busy, so they had no interest in doing that. On top of that, the ventilators, they were the monstrous pieces of equipment, huge ventilators. To move them from one place to from the storage place to the patient's room itself took a little extra time and energy. And the doctors were not exactly happy to do that. And they found this new group of people who they trained and started the profession as inhalation therapy. Little did they know that the profession is going to make a big wave in the health field in future. The initial phase was just giving IPPV, intermittent positive pressure breathing or ventilation, which nowadays we rarely use it, but as a routine, IPPV was used to deliver medication, just like we do with aerosol therapy. Now, IPPV, aerosol, oxygen therapy, pulmonary function, which was spirometry, those are the minor things, and blood gas measurement. Actually drawing the blood gas, running through the machine. These were the only activities in respiratory care. Things were moving up. The technology was developing. Physicians were getting grip on many aspects that the patient's health, pulmonary health can be improved. And new techniques started coming in. New development started occurring. Manufacturers were just watching. Anything you need, they would develop that because they would sell that product. And that was their job, and that's what they were interested in. And respiratory therapists, although they were inhalation therapists, not very dynamic, not very educated, highly educated, but they showed keen interest. Gradually, the profession was people from educated group of people started entering the profession. And plus, the ones who were already there realized you have to have higher education to move up. Now, the education part of respiratory care started with one-year technician schools. Then they added to that 2 years associate degree. Then they added to bachelor's degree. Then the master's degree. So we have this these phases of development in education also, and I saw most of that being incorporated in the profession. Now this is so interesting, and the more I trace back and see where we were and what we had done. People had done many things. Remember the intermittent mandatory ventilation? They developed with one-way valves and the Y adapter and the ET adapters and all that, and they are incorporated in the inspiratory line of the ventilator on their own, and everybody was flabbergasted when they saw the first IMV circuit developed by RTs and put it on the ventilator. The nurses and other people took a notice that this is not our profession. This is too much. This is too much to work on. So anyway, gradually the docs got interested. Indian American Association of Cardiology, American Association of Anesthesia, American Association of Critical Care Medicine, American Pulmonology Association, all these groups sent one physician from their group as a representative to guide respiratory therapists. Now we had our professional growth also going on. We had the what you call political part was going on. We had inhalation therapy, American Association of Inhalation Therapists, which was slowly they realized inhalation implies only inspiration. What about exhalation? If a patient doesn't exhale, he will expire. So the exhalation has to be included. So they decided to change it to American Association of Respiratory Therapy, IARC. Then later on, these guys who worked as respiratory therapists, which is we all were, and we were getting involved in poking our nose in other activities in the in the ICU, such as monitoring blood pressures, monitoring pulse, and eventually monitoring intra-aortic balloon pumps, monitoring swan gas catheters, and all these things. So then they saw that these guys are involved also in cardiac care. So in fact, some departments were not called respiratory therapy department, they were called cardiopulmonary department. So to incorporate everything else, the association decided to call this as American Association for Respiratory Care, not therapy, just care, which incorporates all these things: pulmonary function, sleep labs, then your mechanical ventilation was the primary thing, and plus the floor care. All these were added to the profession. Hospital was happy, and they had one dedicated group was doing this. This started working on. Now, what happened? I mean, I moved from Chicago to Atlanta at Georgia State University, and I was excited to work with the really hardworking and exciting people as faculties. In fact, university had one thing that you, as a faculty, you must publish every year something. Doesn't have to be exotic publication, but some kind of publication, show your interest in academic world. And our department was very active in that, and almost all of us published at least one book at that time. So we had name recognition. I also got involved with American Association of Respiratory Care, where the activities were happening. And we developed a program called International Fellowship Program, recognizing that respiratory care delivered or given in other countries is completely different than ours, because we had a standardized system. They don't, but they have their own sporadic spots in the country where respiratory care was done, but by only a few physicians. No one else was involved. All others were peons. I mean, they would just do go first type, go and bring this, go and do this, make this. So to get them involved, we started this fellowship program where we invited people from other countries to come over and watch and see for 2 weeks what respiratory therapists in US were doing. To our surprise, we had tremendous response from international community. And probably applicants came from 30 plus countries, and we selected only few based on the funding we got. But this continued since 1991 till today. There are about 12 to 15 Indian physicians who have visited United States for this program. These people gave me feedback as to the things happening in India, how respiratory therapy is managed. And they realized that they need to formalize that and also to get into it. But before that, and you will hear about this, Manipal University sent our doctor, for getting old, to Loma Linda University in the US. And he learned everything there. He just saw how it was delivered, respiratory therapy. In fact, some of his faculty were my friends, and they told us, this guy is amazing. This guy is so good and so polite, so down to earth, that he would go to clinicals where it was ridiculous to ask him to watch someone giving aerosol therapy. But he wouldn't say a word. In fact, he would take those classmates who were RT students around X-ray board and explain X-ray to them. So they were all impressed with him. So he came back and he started a program at Manipal, which still exists, is one of the top program, is the top program in the country at this time. So this is where the respiratory care in India started. I had no idea, no clue about it. 2005, I retired from the university, came to India, started spending longer periods of time, 2 months, 4 months, 3 months, and they were inviting me to give lectures in Mumbai and Pune, the close by areas, then Manipal, then Hyderabad, and other places that they also invited me. And then Indian Society for Critical Care Medicine, Indian Society of Anesthesia, and Pulmonology group, they all invited me to their annual meeting and gave talk on mechanical ventilation. Ventilator companies approached me and they asked me that if I could give talks to other parts of the country, to the hospitals where they were their clients. I had a problem. I said, was there any conflict of interest? But then I said, if I don't do it, and I said, no one else has time to go to other parts of the country and go and give talks all the time. And I was available. So I did that, did all over the country, learned about the way things are going. In the meantime, Dr. Vijay Kumar, Dr. Anita Shenoy, Dr. DJ Christopher, Dr. Dr. Anyway, I forget names, guys. My apologies. I do forget certain things. Okay, so these people, they spend many hours away from their old regular job and started helping respiratory therapy profession to grow. They could do only so much. And the younger guys were kind of getting antsy. Come on, let's move, get more therapies to us so that we can deliver those and show how what we are. Gradually, it came to the point that Dr. Suresh Nair from Kochi, he appointed Jitin as an general secretary. And Jitin is a dynamic person, you all know him. The guy wouldn't stop thinking about respiratory therapy even in his sleep. But that helped. He moved the profession, gave quantum jump. And he moved it. He went to the government organizations. He got anything that is needed to get recognition for respiratory therapy, he would do it. Even though currently he is in Saudi Arabia, he is still looking at the profession from all angles. He is a governor for India at the International Council in the USA, IARC run show. So am I. I'm still working as a backup to him. The thing is, profession has grown a lot. People are actually at the council meeting are appreciating what India has done lately. I'm not saying early. It took time for us to gel and get to a point where the quantum jump could be taken. Now comes the point is, where are we going from here? You guys are doing fantastic job. And during the pandemic, you guys have worked so hard that now even in India, where there was a time when no one would know what the respiratory therapy means, now they ask for respiratory therapists. In India, getting a job in respiratory therapy is not a problem anymore. They seek for it. In India, starting a new program in respiratory therapy is slowly growing in every area. In fact, I just heard that even they're starting a program in Rishikesh or somewhere else. Now, remember, majority of the respiratory care was being being moved in south part of India, because the medical community there was very dedicated, progressive, and interested. So that's now the people in North India were busy with their own jobs and all that. But now the current situation is such that the pandemic has taught one lesson, that you need people who are experts in some areas, such as mechanical ventilation. You don't take a general practitioner and ask him to run the mechanical ventilation show. No, he needs someone who is knowledgeable about it. And that's what they found, that respiratory therapy is something that they can lean on. So your profession, you guys have worked very hard lately during the pandemic year, and you have done a great job. And I'm very proud of you, and I'm proud to be a respiratory therapist. And have a good afternoon. Thank you.
Thank you so very much, Professor Deshpande, sir. We are truly honored to have your blessings here today. Next, we have with us Dr. Vijay Kumar Ratnavalusar from Hyderabad. He is an eminent pulmonologist of our time who was the first person who taught us the power of unity, the power of sharing.
Rujita, go ahead.
He was an eminent pulmonologist of our time who was the first person who taught us the power of unity, the power of sharing knowledge. Yes, he was the first person who led us as the president of our association, the Association for Respiratory Care India, ACRI. Sir is also recognized as the International Fellow of the American Association of Respiratory Care in the year 1992, after Dr. Radhika Dhanpal from Bangalore in 1990. Sir, may I please request you to say a few words?
Rujita, can I share my screen?
Sure, sir. Sure, sir.
It's a great pleasure and a privilege and an honor for me. Am I audible?
Yes, sir, you are.
Yeah, thank you. So it's a great privilege, pleasure, and an honor to be invited. And I'm thankful that the IARC has recognized the contributions made by me, however small it may be, way back in 1995, when I realized that respiratory therapy is a growing specialty and requires some attention. And I found out that respiratory therapy was being done, the training was being done at Manipal, at Chennai by Dr. Vijay and at different places. So I thought, why not all of us get together onto one platform? And that is how the idea stuck. And then I created an association, put all of them on one platform and got it registered in Hyderabad. So in the next 4 or 5 slides, I would take you through the respiratory therapy, the troubles it had and the happiness it had, as I call the agony and ecstasy of respiratory therapists. So through my eyes, Dr. Vijay Deshpande, who is an old friend of mine, has been quite elaborate about how ARC grown in stature over a period of time. He joined the Indian respiratory therapist now he is being called as a father of Indian respiratory therapy, but now he has become a grandfather of Indian respiratory therapy. So, so in India, the respiratory therapy has grown from the stage of a caterpillar to that of a colorful butterfly, flying around, touching every flower and creating happiness all over. So I would go through 4 little stories to take you through what respiratory therapy went through. When I started respiratory therapy college in Hyderabad, it was a 2 years course. It was a diploma course after BSc in science subjects. So the first candidate came along with his father, and the father asked me, "Sir, can you guarantee a good future for my son? This looks like a new course. I never heard about it. My friends never heard about it. You call it as respiratory therapy." So I said, "Please trust me. This is going to be a wonderful training and a wonderful profession to take up." And he joined. He joined, and today, yes, he is a successful respiratory therapist who is earning great money in Bahrain. Then comes the head of the department of ICU in my hospital. He said, by that time I had about 6 respiratory therapists who were working with me. And the head of the department of ICU comes and says, "Dr. Vijay, tell your so-called respiratory therapist not to enter my ICU. I don't want them to be meddling with the mechanical ventilator." So it was a big issue. They were not allowed to get into the ICU. But then all the respiratory therapists were so disappointed, disheartened. They came and said, "Sir, what is this? We have come to be the respiratory therapist to manage the ventilators, and here boss saying not to enter." I said, "Don't worry, don't worry." And very soon I started a respiratory intensive care unit with 8 beds, and all these respiratory therapists were happy. They were the ones who are intubating, ventilating, changing the modes, troubleshooting, and it was a hunky-dory story. Then the CEO of the corporate hospital, I went and told him, by the time I moved out to another corporate hospital, I said, "We need respiratory therapists, and let us start a course and let us enlist some respiratory therapists to work in our ICUs." He said, "Dr. Vijay, we are sorry. We don't need respiratory therapists because we have ICU nurses. They will take care of everything." But then after 12 years, that same CEO realized, and then he started recruiting the respiratory therapists to take care of the patients who are in the ICUs, especially those who are on ECMOs and mechanical ventilators. Dr. Guntupalli, Kalpalata Guntupalli, many of you know. She is a pulmonologist and a critical care expert from Houston, Texas. Distress call from Delhi, one of the corporate hospitals. A patient who had ARDS was on a ventilator and he was sinking, he was going down, and the doctors had a tough time managing his ventilator. So they knew Dr. Kalpalata Guntupalli. They sent a SOS call. She simply took the next flight from Houston, Texas, and flew down to Delhi. And as soon as she touched the hospital, the first call was to me. He said, "Vijay, I need 2 respiratory therapists urgently tomorrow at Delhi Hospital." Because that Delhi hospital did not have any respiratory therapist. Not only they didn't have, but also they never heard about respiratory therapists. So by that time, I had almost 12 respiratory therapists who were working for me. And I picked up 2 of the best and put them on the flight to Delhi. They went to Delhi. They took charge of the patient who was on ARDS. And in 3 days' time, they got him extubated. So the hospital was very happy. Dr. Kalpalata Guntupalli was very happy. And more than anything else, the family was very happy. So the hospital offered them, "We will give you double the salary. Why don't you come and join us?" The 2 young respiratory therapists very politely refused, and they came back to Hyderabad. This is the couple. This is the gentleman who was on ventilator, ARDS, and he was liberated by our respiratory therapy colleagues. And this family is a happy family today. This gentleman is a respiratory therapist, again from Houston. His name is John Saul. I call him Santa Claus. So Santa Claus comes to Hyderabad to teach respiratory therapy. So instead of sending people to United States of America to learn respiratory therapy and the latest things in respiratory therapy one by one, spending a lot of money. We thought, Dr. Kalpalata and myself thought that it is a good idea to bring one very experienced respiratory therapist all the way from United States to India so that he can teach about 20 people, 20 students, so that all these 20 people will gain experience, knowledge about respiratory therapy. So John Saul came here, spent almost 6 weeks with us. We took care of his hospitality, and all the 20 students benefited so much. Even today, they remember his classes. Then came a turning point. The very hospital which was not recognizing the respiratory therapist, the lung transplant surgeon there, who is a good friend of mine, he calls me and says, the lung transplant patient is desaturating, Vijay. Can you request your respiratory therapist to take care of the patient? So that was a big crown on the efforts of respiratory therapy. So I have sent one of my respiratory therapists. She went there, took charge of the lung transplant patient. There were some issues with the mechanical ventilator. She set it right. She changed the endotracheal tube. She changed the mode, and then the patient got off to a good start, and he was extubated in 3 days' time. So this was a success story. So again, the same CEO of the corporate hospital who said he didn't want any respiratory therapist. He said, we are very happy with your respiratory therapy in your RACU. Can you recruit 12 more next week? 12 more next week? That is a tall order. So I searched around, and then I found 12 brand new respiratory therapy students who knew only theory, but no practicals. I took all of them and I said, this is a list of 10 things that you should become perfect. So starting from how to put the oxygen cannula all the way to intubation and extubation and the modes, I listed out 10 things, and I told my senior respiratory therapist that you train and make sure that all these 12 students are experts in these 10 items. He did that, and we have taken all the 12 of them into the hospital and paid them a good salary. So friends, we went through a lot of agonies, but at the same time, we had a lot of ecstasies as well. Here are some of the people. Dr. Vijay Deshpande was mentioning about Dr. Kumar. He was also one of the fellows who visited Loma Linda, and Dr. Anita is currently managing the respiratory therapy and anesthesia in Manipal. And this is a group with whom I interacted a long time ago. They're all now grown up. They have all become big people. And this is the respiratory therapist whose father asked, sir, is there a future? Yes, he is in Bahrain. He is working as a head of the Department of Respiratory Therapy, earning a good salary and having a wonderful life. So Vijay Deshpande, you all heard, he came so many times to Hyderabad, so many lectures, so many visits. So he has been given the frequent flyer badge by the Indian Association of Respiratory Care. Thank you, Vijay, for all that you have done for India. So thank you very much for giving me this opportunity, and we'll continue to support Indian Association of Respiratory Care and all that these young people are doing. And a special mention I should make of Jitin, who works very hard. I don't know where he gets his bright ideas, but all the ideas he makes sure are put into practice. Thank you very much.
Thank you. Thank you very much, sir, for your kind words. With the interest of time, I would request all our speakers to kindly restrict their talk to 7 minutes. Moving ahead, the coming session has 2 parts. Let me begin with part 1. In 1995, 2 institutions parallelly started formal graduate programs in respiratory therapy. One was focused in pulmonology and diagnostic side at Sri Ramchandra Institute of Medical Sciences, Chennai, and the other was focused on critical care or intensive care medicine at Manipal University. The visionary leadership of Manipal by their approach towards advancing the profession by establishing international collaborations, escalating the curriculum standards par with international standards, and starting the master's program gained huge momentum. When this specially stated gaining popularity and recognition, there was one most humble, down-to-earth person with a cheering smile who enjoyed it, silently with great fulfillment. It was none other than our Dr. Kumar Venkateshwaran, former head and professor of respiratory therapy and anesthesiology at Manipal. We would like to give a standing ovation to you, sir, and I request all the delegates to raise your hands symbolically as a token of respect to the legend, Dr. Venkatesh Ramkumar. Welcome home, sir. Your kids are waiting to hear from you. Sir, kindly address the audience with your pearls of wisdom.
Thank you, Rujita. It was truly very nostalgic to be listening to the two Vijays who spoke before me, Vijay Deshpande and Vijay Kumar. And, it was truly very interesting to see how the two Vijays have helped the young profession of respiratory therapy stabilize in India. I was also thinking about the foresight of the Chancellor of our university, Dr. Ramdas Impai, when in early 1993, he suddenly decided that somebody should go from the Manipal University to Loma Linda University in California and imbibe the requirements to start a program in respiratory therapy at Manipal. And so I left for the Loma Linda University in 1993, spent a year there and as an observer in the Department of Respiratory Therapy. And I must say that by then I was already a full professor of anesthesia. I was running an intensive care unit, for the previous 15 to 20 years. So when I went to US, I really didn't learn much about respiratory care, and that I must be honest. But what I went to learn was how do I now tailor that program to the Indian conditions, and how do I teach respiratory care to a young group of children who just passed out of 12th standard. They didn't have a medical background. They were just out of class 12. And the challenge for us was to tailor a program in such a way that they would understand how to take care of patients who are very critically ill in the intensive care unit. So that was the challenge that was given to us by our chancellor, and we stood up to it. Now, after completing the year of observership at Loma Linda University, when I came back to Manipal, the very next academic year, we started this program. We had 10 students in the first year. And my story also goes very similar to Dr. Vijay Kumar's story, because on day one, we had 10 very bright faces of students sitting in the room. Along with them, 10 sets of parents were also there. And their first question was very much like what they asked Dr. Vijay Kumar. Can you, assure a good future for my son or daughter? And to be honest, I was as anxious as the students and the parents, because I didn't have a very definite answer to that. So what I told them was, I am also equally concerned, but I know that from our market survey, we do require respiratory therapists in this country. And I assure you that your children will be the ambassadors for respiratory therapy in this country. And I think that's what happened as we rolled along over the next 25 years. I told my students, you need to work yourself into the system. Make yourself indispensable. As all other intensive care units were running in those days, it was the doctor and the nurse who were the primary players in looking after the critically ill patient. So I told my students, respiratory therapy students, work yourself into the system. Make yourself so indispensable that they will want you to look after their patients. And that's exactly what happened, not only in Manipal, but for the stories that I hear from Dr. Vijay Kumar, the story at Delhi, based on what Dr. Kalpalata called for respiratory therapists, all that I think speaks volumes for the way in which our respiratory therapy students, later respiratory therapists, have worked their way into the system and have become ambassadors for this profession. In Manipal itself, we are now into the 26th year, And the department has passed through 5 hands. Yes, I did start it, but I must say that the final shape was given to it by Dr. Anita, Swami, Ramesh, and now currently Pratibha, who's heading the department. So it's passed through several hands, and in the process, we started the bachelor's program, we did the master's program, and we even included the PhD program. And all of this was not done overnight. There was a lot of hard work going into it. And like Vijay Kumar mentioned, there were several other centers that were already doing this program. And to mention in alphabetical order, Chennai was already doing it, so was Hyderabad, Kochi, Vellore, and several other places were doing it in a very, abbreviated form. And I think thanks to Vijay Kumar's efforts, we all got under one umbrella, and we created this platform to roll out a 4-year respiratory therapy program. I think I will keep myself very short, just another minute, Rajita. I just want to say that our respiratory therapists now don't stop with respiratory care alone. Their activities have gone into pulmonary rehabilitation, sleep medicine, pulmonary function testing labs, smoking cessation, domiciliary care, and the recent COVID epidemic or pandemic, as we call it, has really pushed the respiratory therapists to the fore. They have been the front. You have been the frontline warriors, and I think the profession now has such a strong footing that there is no looking back from this point onwards. Thank you very much for this opportunity for speaking at the inaugural, and I wish all our respiratory therapists the very best in their profession. Thank you.
Thank you. Thank you very much, sir. We are forever indebted to you for your contribution towards the profession.
Thank you.
Now, with your permission, let me move on to the second part, the other side of the journey. Sri Ramchandra Institute of Medical Sciences, Chennai. They always remained as silent spectators and immensely contributed to the growth of our profession, especially in the state of Tamil Nadu. If you search across the globe, you will find one binary article conquering that part of the world. The remarkable journey of respiratory therapists at SRMC was started by Professor Dr. T.K. Parthasarthi and Dr. Vijay Lakshmi Thankateshwar. Took over the program. We are fortunate to have you with us, madam, today. Welcome you, madam, and I request you to kindly deliver your remarks.
Am I audible?
Yes, madam.
Okay. Yeah.
Yes, ma'am, you are.
Hearty congrats to the entire team for the Silver Jubilee of IARC and the organizing team of the 14th National Conference of RESCARE'21 virtually. I know how much effort you would have put to bring it to this level. This is a memorable day because it's a Silver Jubilee celebration. And I do appreciate the youngsters for the constant growth of this. Let me, to start with, it was called as Association of Respiratory Care India. Now you have changed over to the Indian Association of Respiratory Care. And I'm also happy to know that you have the biannual journal as IJRC, the official journal of the association. And the vision and the mission are so good that really all of you have put in effort to bring the vision and the mission. And I'm sure you're following the same. I'm happy to see Vijay Deshpande there. And I'm thankful to him because I was also a fellow like Vijay and others. So I spent 3 weeks in US in various states. And my impression about the rehab was the best, I tell you honestly, and the interventional pulmonology. And I was really amazed at the way that the pulmonary rehab in those days were started and how it is going on. And here I must place on record the efforts put in by Dr. Anita Shanae and Jitin and Sami. And really, I remember the day, Vijay, when we all went to Manipal and had the meeting there and how much of discussions we had before we could get things done. That's a memorable day, if you ask me. And really, it's nice to be the founder member of the Indian Association of the Respiratory Care. It is nice to see this grown to this level. And now I believe there are more than 1,000 life members, and it's really a great achievement. And that this is due to the tireless effort put in by the Manipal team. I must congratulate and applaud the entire Manipal team, and with, of course, Jitin and the other youngsters. I must tell you here that as Vijay Deshpande rightly said, to start with, it was only inhalation therapy and the oxygen therapy. But now, as Dr. Ramkumar was saying, we have developed to such an extent that it doesn't stop with that, not only with the intensive respiratory care and sleep medicine interventions as well, where our students are doing a good job. And now the COVID-19 pulmonary rehab has taken real start, and I should place on record the efforts put in, and you are really the frontline warriors, if you ask me. Okay, COVID has gone, this 1.5 years of pandemic has been there, but what is the result of it? And that is being taken care of by you people. So you should be included as frontline warriors as well. And as Dr. Ramkumar was saying, and the Vijay was saying, we started in the year 1995. And if I remember correct, I'm not very sure, we were the first to have the 4-year course, and Dr. T.K. Parsade, we call him the father of the Allied Health Sciences of Sri Ramchandra Medical College and Research Institute. He wanted 3 years of education plus 1 year of internship, with the idea of these students going to US, where they need 16 years of their schooling before they enter into the graduation. So that is how it started in 1995. To start with, we had the respiratory and the cardiac, because Dr. Patsadi was very much keen in starting the respiratory therapy course. We called it respiratory therapy. Now it is being called as respiratory technologies. And I should say now that since 2 years, we have been having the post-graduation also in the same field. And the Tamil Nadu state has recognized the BSc AHS as in 1999, so that our students can get into the service of Tamil Nadu service. And now the National Commission for Allied Health Care on Profession Act was enacted by the Government of India on the 28th March 2021. The aim of this act is to regulate and maintain the standards of education and services by the allied health and healthcare professions. See, this is a great achievement, if you ask me, by the entire team of the allied health sciences to get the government order. Qualified allied and healthcare providers required to register with the statutory body. This act will be a boon to improve the quality of allied healthcare services in ours. This is a major boon, I should tell you, and the government of India, it was passed in the parliament. So before I conclude, I just want to say my advice to all the youngsters is follow your theme, which is the need of the hour. That is this year's theme, patient safety and quality care. Please remember, this is a legal era, so I would like all of you to follow the ethics and practice the respiratory care of the ailing patients, which gives you the maximum satisfaction. All the best to each one of you. Thank you to the organizers.
Thank you, thank you. Thank you very much, ma'am, for your kind words of wisdom. I also take this opportunity to thank Minimala Rao, ma'am. Ma'am, in the year 1995, started the formal PG diploma course in respiratory therapy in the Hyderabad region. Unfortunately, ma'am could not be present with us today. However, she has a small message for all of us. We have with us Anita Patil, ma'am. Ma'am has done her postgraduate diploma in respiratory therapy from Hyderabad in 1999. She is currently working in care hospitals since 2020. Ma'am, may I request you to kindly share your words? Anita, ma'am, are you here?
Anita Patil, ma'am. Anita Patil, ma'am, can you hear us?
Okay, I think ma'am is busy. We'll move on. We cannot talk about leadership without talking to the leaders of our profession. We are honored to have with us some of the stalwarts of our profession who, as respiratory therapists, have helped our profession reach great heights and have been a source of inspiration to many. The celebration is incomplete without your presence. First, I would like to call upon Dr. Swami Johnson, a bold and dynamic leader for the respiratory therapists in India. She is not only an alumni of Manipal, but has also headed the Department of Respiratory Therapy during her PhD. She's contributed to the RT field not only academically, but also administratively through the IARC in its early years. As the General Secretary, her support and contributions to the Indian Journal of Respiratory Care as a part of the editorial board are notable. We are grateful to have you as our senior ma'am. I now would like to invite Dr. Swami Johnson to kindly address the audience.
Hello, everyone. This was a surprise that I would be called because I am in the hospital now. You would hear a lot of background noise. If that is okay, can I speak?
Absolutely, no problem. Please go ahead.
Yeah, I'm sorry. I was not knowing that I would be called anyway. I am thankful to you for the opportunity. I was happy to see all the pillars of the respiratory therapy for India, all the doctors, Dr. Ramchandra sir, Dr. Anita Imam, Vijay Lakshmi Thanasekaran ma'am, and Vijay Kumar sir, Vijay Deshpande sir. I have not seen them for too many years. So I was very happy to see them now. And I'm very happy about the office of IARC that is functioning now. The dimension has changed from what we had done before. We are happy to have the national accreditation of the respiratory technicians now. I hope it would become respiratory therapy soon. So I'm very happy to see the celebration of too many years of 25 years of existence of respiratory therapy. It is not a small thing for a respiratory therapist like me. I was happy enough to have my all the degree from India, and it is recognized worldwide. So I'm back to India very soon, and I hope to continue in respiratory therapy. So I have just no acknowledgement to all the doctors and all the teachers who have taught me, and thanks to all the office bearers and the current president and vice president and general secretary for all the good things. Thank you so much for the opportunity.
Thank you very much, ma'am, for your kind words and sharing your experience. I would also like to call upon Dr. Narasimha Murthy, sir. Sir was the first General Secretary along with Dr. Vijay Kumar when AICI was formed in the 1990s. He organized more than 4 RESCARE conferences during the most difficult initial times when a very handful of people were knowing about respiratory therapists as a profession. May I please request you, sir, to kindly address the audience?
We can't hear you, sir.
Hello.
Yes, you're audible now.
Silver Jubilee celebrations. It's a privilege for me to be a part of the Silver Jubilee celebrations. And from Hyderabad, under the leadership of Vijay Kumar sir, the association was started for the first time. And one of the members of that, it's a great honor for us, to be frank. And I feel like my own kids have grown up to 25 years of age. We have taken care of that one in the infant stage, maybe just nourishing it, not to have made achievements like this, but it's a privilege. And I thank all the faculty and the pioneers who have supported us. And it's a great privilege for us with all this faculty. Thanking you. Thank you.
Thank you. Thank you very much, sir. Dr. Anita Imam is the first president of the formally structured, legitimately authentic professional organization, the Indian Association of Respiratory Care. I don't have to introduce ma'am to any of the respiratory therapists in India. She is well known to all of us. And moreover, her contribution over the past 10 years as the editor-in-chief of our journal, the Indian Journal of Respiratory Care, was a remarkable journey. The journal started as a simple magazine named as Inspire, which emerged as the title publication of IARC, Index Journal, brought into a shape what you see today, all done by just one person. Every development at IARC and our profession over the past years has her touch on it. And she's that close to our lives. She has influenced us knowingly and unknowingly. The scientific deliberations are a tribute to you, ma'am. Please accept our prayerful request to say a few kinds of words.
Hello, can you hear me?
Yes, ma'am, we can hear you.
Ma'am, we can.
Okay. Thank you very much, Rujita, for the very kind words. And also thank you very much for the invitation to attend this inaugural function of RESCARE, very special RESCARE, the Silver RESCARE. It's been so lovely to listen to the doyens of respiratory care. All that they have said is so true. And respiratory care has really come a long way. I won't repeat what they have said, but really happy to see the progress that respiratory therapy has made over the years. I really commend the energy, enthusiasm, and efficiency of the organizing committee and members of IARC, not just for holding the conference, but coming all the way. I mean, so much of energy is there in young people, and all utilizing it. Jitin, Sulochana, Madhura, Rijita, all others. It's not easy holding a conference, even online, and that too in the middle of a pandemic, and the pandemic is not yet over. My heartfelt felicitations to all the RTs who played such an important role, not only in our ICUs and hospitals, also in the pandemic management, either directly involving with the clinical management of patients or indirectly by educating people all over the country, even online. Now, COVID-19 has highlighted the profession of respiratory therapy and its contribution to healthcare. People know you now. And now it's up to you to take this faith placed in you forward and consolidate that confidence in you. Friends, it's been 25 long, good years, but your golden years is now, golden time is now. Seize it, make the best use of it, and shine forth. Congratulations and best wishes to you. Yeah, thank you.
Thank you very much, ma'am, for all your support to the respiratory therapy profession over all these years. So now I would like to play a short video. I would request the technical team to play a short video about the journey of these 25 years of IARC. We managed to contact around 10 stalwarts and invited them to be a part of this landmark event and leave a mark on this historical day. Unfortunately, due to their busy schedules, they could not join us today, but most of them have registered to the conference and have conveyed their best regards to all the delegates and panelists. I deem it as a great honor and privilege to propose the vote of thanks for this auspicious inauguration ceremony. First and foremost, I would like to thank all our esteemed guests and dignitaries who honored this function with their inspirational thoughts. I also extend my heartfelt thanks to all the speakers, stalwarts, and all my fellow artists for joining us today. I hereby conclude the inauguration ceremony here. Let's move ahead to the most awaited scientific program. The scientific program today is going to be a scientific extravaganza, which is going to be a ventilation day. We will be having an interesting panel discussion at the end of the day today, and I'm sure none of us would want to miss that. I have a few important reminders for the audience and the speakers before we go ahead. Kindly put in your questions in the chat box. Also, a kind reminder to all the speakers, we have exactly 20 minutes for the talk, and a buzzer would be played after 15 minutes, which would indicate that you have 5 minutes left for the talk. So now, without any further delay, let's go ahead with the first topic of the day, pulmonary mechanics during mechanical ventilation. We have with us Mr. Dr. Ramchandra Venkateshwaran. Sir holds an MBBS degree and has completed his MD in anesthesiology from JIPMER, Pondicherry. Sir has served as a head of anesthesiology at Kasturba Medical College, Manipal for 14 years before retiring in 2017. We are pleased to have you with us today. I request everyone to put in their questions in the chat box during the session. Thank you.
Good afternoon to all the delegates attending the 14th National Conference of the Indian Association of Respiratory Care. I understand we had a very successful day yesterday with 5 workshops, the day ending with the paper and poster presentations. Today and tomorrow, we'll be having a series of 20 lectures, and I'm indeed fortunate to be starting off the first of these lectures on the topic pulmonary mechanics during mechanical ventilation. I would like to start by introducing a term called fluids, which in physics essentially means gases and liquids. When we talk about the basics of fluid dynamics, both gases and liquids always flow along a pressure or a concentration gradient, and this is true not only for blood flow within the vascular tree, but it is also true for the flow of gases within the respiratory system. Therefore, for gases to flow into the respiratory system,